Basically, there are two types of urinary incontinence: stress urinary incontinence and urgency urinary incontinence. Stress urinary incontinence is related to weakness of the pelvic floor and the closure pressure of the urethra. Women usually will leak small amounts of urine when they are exercising or sneezing, as the intra-abdominal pressure creates pressure on the bladder and small amounts of urine will come out through the urethra. As I mentioned, this is related to the weakness of the pelvic floor musculature and the inability of the sphincter to close down tightly. Urgency incontinence is more related to intrinsic bladder abnormalities and neurologic conditions. This is experienced by an overwhelming desire to void and the inability to stop urination. Patients who have urgency incontinence usually have marked frequency and void small amounts. They will also have episodes of urinary leakage, at which times they will usually leak large amounts of urine. Some of the causes related to stress incontinence include childbirth and estrogen deficiency. In addition to this, anatomic problems as a woman age with loss of pelvic musculature and cystocele can also result in urinary stress incontinence. The most important thing with any patient is to first take a good history and physical to determine what is their particular problem. After a history and physical is obtained, we will examine you to see if you have any urinary leakage and we can recreate the situation. After this, other additional testing may or may not be necessary. These may include an ultrasound of the bladder to see a picture of how your bladder looks. In addition to this, we may undertake cystoscopy to look at the inside of the urethral tube and the bladder. Urodynamic study may also be undertaken to assess the function of the bladder and the urethral tube. In all cases, urine analysis and urine culture should be checked to make sure infection is not an underlying cause. I would like to talk a little bit about treatment options for urgency incontinence. Urgency incontinence is usually related to intrinsic bladder abnormalities or neurologic conditions. First-line treatment for urgency incontinence include oral medications. There are two different types of medications that are very successful in helping with this problem. When medications are unsuccessful, there are other modalities available. These include direct sacral nerve innervation or Botox injections within the bladder. In conclusion, I would like to say that most cases of urinary incontinence can be vastly improved without surgical intervention.